Good afternoon, everyone. Looks like people are still trying to log on. Welcome to the Future of Medicine program. So happy to see so many of your names. My name is Lindsay Code. I think I spoke with a lot of you previously, but I'm the VP of Strategic Operations for the Sacramento Valley Medical Society. And again, we are just so excited to have all of you join us for this Careers in Healthcare program. We have students from the following high schools that are participating: Encina Prep, Foothills High, Grant Union, Rio Linda, Hiram Johnson High School, Pleasant Grove, Indercombe, West Campus High, Granite Bay, Da Vinci Charter, and finally the Met. Again, we're thrilled to have all of you. Before we get started, just a few housekeeping items. You may turn on your camera if you choose. I know many of our speakers would love to see your beautiful faces, but it is entirely up to you. Also, make sure you are on mute unless you have a question and I have specifically called on you. Speaking of questions, if you have any, make sure to type them in the chat box or just raise your digital hand, your virtual hand. I'll call on you in order to ask your questions at the end of each one of the sessions. Now, if you attend each of the sessions this summer over the next 2 weeks, you will be entered into a drawing to win a $100 Visa gift card. There will be 5 winners drawn at the last session that's to be held in person at the Medical Society offices in East Sacramento, Friday, July 2nd. If you need transportation to that session, just let me or Sam know, and we will make sure that you get there. Now, to get credit for attendance to be entered into that drawing, make sure that your Zoom name actually matches the name that you registered with. So today we will kick things off with a session on why you should choose medicine. Our speakers are all members of the Board of Directors for the Sacramento Valley Medical Society: Dr. Vanessa Walker, Christina Bilyeu, and Dr. Ravi Khaira. First up is Dr. Vanessa Walker, a pulmonary and critical care physician with Pulmonary Medical Associates and the medical director for Sutter Health Valley Area Electronic ICU and director for physician quality at Sutter Roseville Medical Center. Now remember to add your questions to the chat or raise your virtual hand, and I will read your questions or call on you after all of the panelists have spoken. Dr. Walker, you're up first.
Hello, everybody. I'm so excited to be with you all today, mostly because I want to just really share my appreciation for you coming and listening to us and being interested in medicine, because truly you are the future of what we're trying to accomplish. We can do all we can right now, but it's going to be in your hands in the next 20, 30 years. We need all the help that we can get. So I'm very excited that you guys are even showing an interest in getting into medicine. We're going to be talking about our journeys as physicians. There are many, many other careers that you can join in healthcare, which are just as invaluable and important to participate in. But this is what we chose. And so obviously we're a little bit partial to being physicians. I myself am an osteopathic physician, which is a little bit unique to some of my counterparts that are here today who are both allopathic physicians. But what that means basically is that I went to 4 years of osteopathic medical school, and during that time did a very similar curriculum to what the students that get from an MD curriculum is. I just got some additional coursework in something called osteopathic manipulative medicine, which, and for those of you that have seen maybe chiropractors do their work or have gone to a physical therapist, a lot of the techniques used by both of those professions actually originated from osteopathic medicine. The origins of osteopathic medicine actually started back in the late 1800s when a physician, Dr. Andrew Still, had unfortunately his whole family die of spinal meningitis. And at that time, there really wasn't anything you could do for meningitis. And so he looked at, what tools do I have at my disposal? And what he had was looking at the human body as a machine. And if you make all the parts of the machine work well together, then perhaps the machine will ultimately work longer, work more effectively. And so he created this, this practice of medicine where he just wanted to make sure that the bones and the muscles and the lymphatic system, which is the part that kind of helps drain some of the fluids around your body, are all in optimal work so that you can be as healthy as possible. And many of his, the things that he created now live today in a variety of our specialties throughout the delivery of medicine and healthcare. So I'm proud to be an osteopathic physician, which is a DO, and I want to make sure that you all know it's a very viable pathway to becoming a physician practicing medicine. Now, why did I become a doctor? I became a doctor because I said I was going to become a doctor at the age of 5. My mom was a nurse and my dad was a respiratory therapist. And I thought, well, I have to be a doctor. It was just the next logical step. And I kind of just, worked my way towards it. What I found out is I'm so grateful that I did become a physician, because it's truly a privilege to work with people during some of the best times of their life and some of the worst times of their life. And being able to help them and be given confidential information brought into their home, into their lives, when they're in need, there is no greater feeling than being able to help somebody when they're vulnerable. Not only are you helping a person, but you're feeding your soul, in my opinion. It really is a truly just a great profession to be in. It's also pretty cool. I'm a pulmonary and critical care specialist. So not only do I do regular medicine stuff, deal with, patients with pneumonia, things like that, but I also deal with really cool stuff. I get to do procedures. I get to do bronchoscopies, which is where I take a camera and go down through people's nose or mouth into their lungs and take biopsies if there's possibly a cancer there, or help stop bleeding, or diagnose different types of infections or lung conditions. When I'm in the ICU, I intubate, which means I put a tube into their airway to help them breathe. I oversee CPR in the event that somebody's heart stops beating. So lots of really cool stuff that I do in my regular practice. And just, working in the clinic, I also have a pulmonology clinic and I take care of patients with lung disease. So really lots of variety in medicine, as you'll get to see with some of our colleagues coming up. I believe we have one of our colleagues is a psychiatrist and the other is a pediatrician. So much opportunity in medicine for everybody to be involved with. The main thing that I want to stress is how important it is for those of you that know you want to get into medicine. If you decide, I really want to be a physician, that sounds awesome. It is a long, dedicated, hard road, but that does not mean that you can't do it. Take every opportunity that you get to try to shadow someone. I'm always happy to have people shadow me. If you're interested, you can get in touch with Lindsay or Sam and see if we can get you in touch with us. I'm sure any of us would also agree to do some shadowing. See if you like it, find out if this is for you, because it's going to be 4 years of college, 4 years of medical school, and then at least 3 years of residency training. I myself did 3 years of residency training, stayed on an additional year as the chief resident of my internal medicine residency program, and then did an additional 3 years of pulmonary and critical care medicine. So basically the entirety of my 20s gone to studying medicine, but I don't regret it. And I would do it again in a heartbeat because of all the cool things involved. For those of you who are women that are watching and interested in having families, it puts a little bit additional degree of difficulty on becoming a physician, because you're also right in the middle of times when you're wanting to potentially, if you want to, get married or have babies, things like that. But once again, totally doable. I have a 5-year-old, 7-year-old, great support at home. So anything is possible. If you want to do it, you absolutely can do it. And just find people that will help support you in any way, because there's so much to do. I want to make sure, am I getting close to my time? How much more time do I have left, Lindsay?
You have, 6 or 7 minutes.
Okay, perfect. I just wanted to make sure. I talk really fast, but I didn't want to blow through everything that I had to say. So when it comes to preparing yourself for a career in medicine, my recommendation is to major, when you get out into college, is to not necessarily major in pre-medicine, okay? Because it's a good stepping stone, but you can take all the prerequisite classes that you need in order to be a physician. Major in something that inspires you, major in something that you really like. If you want to major in a language, that's excellent because you can help your patients speak that language potentially. If you want to major in other types of cultural studies that will make you more of a diverse person that can understand all the people and where they're coming from, do it. Major what you want, and then you can take the classes that you need to prepare you for medical school. But I think the more well-rounded you are, the more you experience the world, the more that you interact with people that are not from your background, because that's going to be key. Your whole life as a physician is dealing with other people that are not like you. And that's a good thing. You just need to make sure that you're really good at interacting with them and trying to visualize yourself in their shoes. One of the biggest things that we as a profession are running up against, something called social determinants of health. And what we are finding is that actually 20% of the stuff that I do as a physician helps people. Only 20%. The other 80% comes from how are they getting on in their life? Do they have access to food? Do they have shelter? Do they have transportation? Do they have education that they need to be able to understand the medical conditions that they have? So if you can major in something that would help address some of those situations and make you somebody who is able to navigate that type of part of medicine, I think that would make you just invaluable as you're trying to apply to medical school or go into any of the other professions. Because if we can help our patients get the food they need, get the resources that they need, get the education and the medicines they need, then you'll be able to do much more on that standpoint than coming to see me in intensive care unit when I'm trying to fix everything that's broken. So I think that's a really cool area that even if you decide not to get into medicine, if you want to help some way in the healthcare field, helping in all of those various fields will actually support medicine. So whether it be social work or investigating on how you can address social inequities and inequalities, so much that you can actually do to support the medical field and your family and everybody around you. I think other steps along the way in my journey, volunteer work. If you can volunteer as early as possible to get involved in something that you like, don't just volunteer to have it put down on your CV, because the people that are interviewing you will see right past that. They want to see you talk about something that you're passionate about. If you really want to work at a food bank because you find it really important to make sure that you're addressing food deserts and food inequity, then get yourself educated about that. Find out about it so that when you go and do, you can actually help. And then when you can speak really intelligently about what you're volunteering with. So I would definitely recommend volunteering in, like I said, any capacity, animals, whatever, because what they're looking for is somebody who cares about something beyond themselves and wants to help, just make the world better than it was when you came into it. And that's something I wish people had told me, because I did the whole requisite, volunteer work, and I didn't do something that I was really passionate about. And I kind of missed that opportunity to get involved in something I liked. I kind of just did something that put in the hours and was a little checkbox on my resume. But I think I missed out on an opportunity to do something that really could have been meaningful, that I could have then continued and carried on into my future now. Because the things that I'm interested in now, if I had been doing this all along, I would probably be more effective at what I'm doing now, and have a little bit better understanding as to how to help people the best way. So I think that's kind of all I have. We'll save questions at the end for my journey, and I'd love to hand it over. I think it's to Dr. Bilyeu. I think you're next.
That's correct. And just a reminder, if you have a question, raise your virtual hand or put it in the chat box, and we will work on answering them at the end. Dr. Bilyeu, you're up.
Hi, everybody. I'm Christina Bilyeu. I am the Chief of Psychiatry here at Kaiser Permanente in Sacramento and Roseville, and I am very excited to be with you all today, and thank you all for coming. I echo 100% of what Dr. Walker said, and we'll touch a little bit on some of that. So why I wanted to go into medicine, why I wanted to become a doctor is pretty much similar to Dr. Walker. My mom will tell me that, at age 3 or 4, she asked me what I wanted to do when I grew up, and I told her I wanted to be a doctor or a firefighter. And clearly not a firefighter. And but I became a physician, and there was no one else in my family that was a physician. I don't know where it came from. I think sometimes we are born with these desires and these callings, and we grow into them. And so I was also the first person in my family to pursue an advanced degree. So I had a lot of support from my mom, my grandparents, my then boyfriend, who is now my husband. Um, so I think, echoing what Dr. Walker said, having somebody that's in your corner that will push you when you don't think you can push yourself, and that believes in your dream as much as you do, and sometimes in those times when it's really hard, more than you do, is essential. So find that person or people, and hang on to them. So through grade school and junior high, and high school, I kept on that path of, I'm going to be a doctor. I was a student athletic trainer in high school and in college, and so really trying to keep myself as close to medicine as I possibly could, and using my time both in high school and college to learn more about the body and how it works, and really picking the brains of people that were in that field. And when I started college, like thousands of people that have gone to medical school before me, I just thought I had to major in biology, or had to, be pre-med. And what I found was that wasn't super interesting to me. And college became a bit of a struggle. And so after a long talk with my mom and with my college advisor, we decided that I would change my major to something that I was more passionate about. And just like Dr. Walker said, that is so important. And what I learned from that conversation with my advisor was I just needed to complete the prerequisite classes for medical school. I didn't necessarily have to have a certain major or something. So I wound up majoring in biological anthropology and anatomy. And I went to Duke University, and they have a primate center there. So I basically, the last year and a half of my college experience, got to play with monkeys and primates, and it was super cool, and I loved it. And it was just a way for me to, and I also learned about just different cultures, and just how people think. That's probably why I eventually became a psychiatrist. So, but because I changed my major a little bit late in the game, I had to, once I graduated from college, I went back home and moved back in with mom and dad, and did a year-long post-baccalaureate program at the University of Miami. And I just really just hunkered down and focused on, getting those prerequisites done, doing as well as I could, and just really taking taking it. And just, I spent time shadowing, still volunteering, and I spent some time working at Starbucks as well, which was a different experience. And I actually wound up, from the time that I graduated from college to the time I went to medical school, was 4 years. And a lot of people will go straight from college to med school, but I'm so grateful for that time that I had. Those 4 years are invaluable to me. I worked a full-time job. I learned all about paying rent and paying my own bills, and just really maturing. And so I say all that to say, you don't have to follow a certain path that everyone else follows. If it takes you a little bit more time, that's okay. You continue to pursue your dream. And it was within those 4 years that I realized how valuable the support of other people was, because the first time I applied to medical school, I did not get in. And my mom will tell you that if you ever have the chance to meet her, that I laid on the bathroom floor and cried. And she looked at me, she gave me a few minutes and she looked at me and she said, "What's your backup plan?" And I said, "I don't have one." And she said, "Well, then we get up and we try again." And I'm so grateful for her for just continuing to push me and believing in me. And I was obviously successful into getting into medical school the second time around. So again, just don't give up on your dreams. So after medical school, very similar to Dr. Walker, 4 years of med school. I then did 4 years of residency in psychiatry, and then I did an additional 1 year of training in consultation liaison psychiatry, which is instead of seeing patients in the office, I would see patients on the hospital floors or in the emergency department. And that's pretty much what my day to day looked like up until I became chief of my department. I would go and I would see patients in our hospital here in Sacramento, whether they'd been admitted for, sometimes people are admitted for medical reasons, for surgery, or maybe they're delirious because they're really ill. I see people in the ICU and on the regular medical floors right after surgery, or I see people that come in to the emergency department who are in the midst of having a mental health crisis. So maybe they're acutely suicidal or significantly depressed and are really just struggling with kind of functioning day to day. And so the thing that I love the most about my job is no day is the same as the day before. Every patient is different. Every patient's story is different. And even if I've seen that patient before, the circumstances for why they are presenting this time are always different. Nothing is ever the same. And I think that's one of the most valuable things about um, being in medicine is that we have this opportunity to hold space for people and to listen to their stories and hear what they're not telling us and really understand how they work, not just their physical body but mentally as well, because they all go together. If one thing isn't working, if it can affect another thing. If mentally you're not feeling well, that can definitely affect how you're feeling physically. And so I'm really just grateful for the opportunity that I've had. And I wanted to share, I think I have a little bit more time. I wanted to share just a patient story with you all. It was one of the one of the things that has probably impacted me the most and left the biggest kind of imprint on me in my career in medicine. And I had been uh, at Kaiser, I think, for about a year and a half, maybe 2 years. And I got called to the emergency department to see a patient that had a complaint of not being able to sleep. Hadn't slept for a few days, and they were pretty irritable and just a little bit agitated. And so we got them admitted to the hospital. And when I went to go see them again after talking to their family, I kind of got this sense that we were dealing with more than just a case of not being able to sleep. And in medical school, they will tell you if you hear hoofbeats, think horses, not zebras. And what that means is common things are common, and you're rarely going to find, some strange disease or illness that is responsible for your patient's presentation. Well, what you come to develop in medicine is, this sixth sense, this gut feeling. And my gut feeling was telling me this is a zebra. This is something that's different than what we're used to seeing. And so we got the patient admitted. I shared my concerns, my thoughts with the physician that was taking care of her primarily in the hospital, the medicine physician, and we consulted a neurologist. And after multiple tests, multiple biopsies, multiple MRIs, the patient was diagnosed with anti-NMDA receptor encephalitis, which is an encephalitis which causes brain inflammation and can actually mimic psychiatric illnesses. And so a lot of people that are diagnosed with this are admitted to psychiatric hospitals, and their treatment for this is delayed. But because we were able to identify it early and treat it pretty aggressively from the beginning, she was able to, she was in the hospital for weeks, and but we were able to treat the patient and able to get her discharged. And the most impactful thing for me, obviously, you know, as a physician, when you get something right, it feels good because you know that you're helping your patient. But I will never forget, I was standing at the crosswalk coming from the hospital, and the patient was standing on the other side. This was a couple of months after she was discharged. And being able to see her out of the hospital, walking around all on her own, and seeing how well she had recovered was pretty amazing and pretty impactful. And it just reminded me of why I wanted to become a doctor, and just being able to help people. And, you know, as Dr. Walker said, this journey is long, and sometimes it can be really hard. But I'm humbled every day that I get to do what I do. And I would not for 1 minute change any part of my journey, even those times when it was really difficult. So I thank you all, and I can't wait to hear your questions later.
All right. Thank you, Dr. Blue. Appreciate it. And finally, we have Dr. Ravi Khaira, a pediatrician and president of the Children's Medical Alliance. And he's also the associate professor of pediatrics, adolescent medicine, and public health with California North State University School of Medicine. Ravi, you're up next.
Thanks, Lindsay. Hello, children. How's everybody doing? I see lots of cool smiling faces. Thanks for coming and listening to me about my journey. Does anybody like Star Wars? I thought the backdrop would be actually better than having to look at the mess behind me. You guys, I'm a child of immigrants. My family came to the United States during the partition between India and Pakistan. My family was displaced and were refugees living in a refugee camp, and my father decided he'd had enough of that and came to this wonderful country in 1957. I came along in 66, but my family roots run deep. I've gone back to India, seen my ancestral village in Pakistan, and it makes me really humble and happy to be in this wonderful country and the options that you guys have, making choices to what to do in your future. I ended up at UC Davis in 1984, and I wanted to be a chemist. I graduated from UC Davis with a degree in chemistry and biology, and I had a great job out in West Sacramento as a high-resolution extraction chemist. Does anybody know what that is? No? Well, basically, I was working behind a hood, testing soil and water samples for toxins, and it was a really good job. My company sent me down to Huntington Beach, where there was a large oil spill back in the late 80s, early 90s, and I was in a scuba outfit, self-contained breathing apparatus, and I got sprayed with a toxic chemical called methylene chloride, and I had to strip all my clothes off and get showered down, and I felt this stuff going into my body, And it was at that moment in time I decided I didn't want to be a chemist anymore. So a bunch of my friends were at Cal Poly Pomona. I took a couple of courses, said, hey, I want to go to medical school. And I went down to a medical school down in the Caribbean called St. George's University School of Medicine. And the moment I got off the plane, I realized, what am I doing? But I made the most of it. I ended up transferring to Cornell in New York and completed my third and fourth year of medical school there. When I was going to medical school, I thought, okay, I want to be a surgeon. Well, during your third year of medical school, you're put through 9 different cores: internal medicine, surgery, psychiatry, OBGYN, pediatrics, psych, emergency medicine, neurology. I mean, you spend 6 to 8 weeks, depending on what rotation it is, in those fields as a third-year medical student, doing rounds, seeing patients. And it's during that time that you pretty much decide what you want to do. Well, I went into it thinking I wanted to do surgery. I didn't like that. I go, okay, I'm going to do internal medicine. Mind you, you guys, this is your third year of medical school. And like Dr. Walker had said, you're in your, pretty much near the end game where you have to decide what you want to do. And then I didn't like psychiatry, didn't like OBGYN. I didn't like any of the other specialties. And then I called my mom and I said, I think I'm going to quit medical school and go back and be a chemist. And she said, well, why don't you try pediatrics? And I went ahead, and my first day was like an eye-opening experience. I love kids. I like being with kids. I want to do things with kids. I actually am a 55-year-old kid. I like Star Wars. I like playing with kids and watching manga and getting on the PlayStation and doing things that other kids do. And I see more eye to eye with kids. And it was at that moment in time when I had my first patient, who was back in the early 90s. HIV and AIDS was a condition that was essentially a death sentence to adults or those people that acquired that disease. And for a child born, with AIDS or HIV, that's even a bigger tragedy and a bigger travesty. And my patient that I fell in love with was suffering from that. He was a 5-year-old young man. And I spent most of my days and nights hanging out with him and the other kids that were on the floor at the hospital at Coney Island. And at the end of my rotation, regrettably, my patient passed away. That's when I decided that I wanted to be a pediatrician. So I'm going to share a screen with you guys. So this is Pediatrics and the Science of Being a Pediatrician. Pediatrics is primarily concerned with physical, emotional, and social health of children from birth to young adulthoods. And we're concerned mostly with the well-being. We're involved in prevention, early detection, and management. This morning, I have a couple of residents that are at my clinic, and we're watching how they actually do their physical exams. And remember, children don't talk up until a certain amount of time, and you have to elicit the history and examine them and come up with issues that need to be taken a look at in early detection, such as developmental abnormalities, speech deficits, physical deficits, or things that the children are going to need extra help with. We also deal with social problems. A lot of kids have, mental illnesses, and we don't really look at that kind of stuff primarily because they don't talk to you and tell you what's going on. So that's another thing that we have to be advocates for as pediatricians. It's a medical science. We encompass a broad spectrum of health services ranging from preventative health, which is kind of like what I do at a primary care setting. I work in a clinic. I have children that I see, coming in for regular scheduled visits for their vaccines and well checks when you have your sports physicals, the kids come in. But we also have a broad range of ability and able to diagnose acute and chronic diseases and how to treat them and prevent them. So I put in a cartoon. Sorry, I didn't come through really well, but if you can see it, the doctor is saying to Jimmy, I'm sorry, but the results of your test show that you're not allergic to vegetables. So the role of the pediatrician is a child's physician who provides preventative health care. We also look at the things like acute and chronically ill kids. We can manage them in a critical care environment. We're certified to be able to do hospital work, and as a pediatrician, we can take care of them in the critical care unit from as small as like a 500-gram preemie at 24 weeks of life, all the way to like a 20-year-old, you know, outside linebacker for the Utah State Utes who's a monster. We manage their physical and mental well-being. We focus generally on newborns to about 18 to 21 years of life. We can also treat infections, injuries, genetic abnormalities, malignancies such as cancer, and then organic diseases and dysfunctions. There's a lot of complex diseases that pediatricians are very well qualified in dealing with, such as enzyme deficiencies, kids that can't, you know, process sugar or can't process protein. Those inborn errors that they're born with, we have to, you know, come up with a special diet for them in order to get treated for that sort of disease. We also, you know, work with other specialties within pediatrics. So a pediatrician like me goes to medical school after undergrad. So 4 years, like Dr. Walker said, undergraduate. Didn't necessarily, you know, do pre-med work, but some of my prerequisites for medical school were covered in my chem and biology minor. We also do the 4 years of medical school and then 3 years of pediatric specialty after the residency. Some pediatricians like me that are board certified go on and do subspecialties within pediatrics. So if they like gastroenterology, like stomach and intestine issues, hem-onc, which is dealing with blood and cancer issues, pulmonology or allergy, which is lung and allergy issues, neonatology, they can be a specialist just staying in the hospital for neonatology care, intensive care, like the pediatric intensive care or emergency medicine. When they're fully trained, we can run the spectrum as a pediatrician, but some choose to subspecialize, and that's all they want to do. And then at the same time, you know, we are advocates for children's rights. And excuse me, guys, my cat's getting into stuff. What? I have a cat. And so we're advocates for kids as far as their rights are concerned. Remember, children have rights, okay? And there's a convention of rights that is established by the United Nations that protects their safety, provides education, nurturing and education for their parents, protection from violence and abuse, and all that kind of stuff that, you know, as pediatricians, we're court mandated reporters and we have to protect the kids that we take care of, especially in an environment where, you know, obviously they're helpless. But we also want to support the family and also provide tools to help the caregivers, be it their biological parents or adoptive parents or any other guardians, and the ability to nurture the children as they're growing up in that household. So here's a little summary of like just certain definitions. You know, with kids, it's, I wanted to include issues like obesity and CDC defined categories, because I wanted you guys to see in one particular field what pediatricians specialize. It's important to actually, you know, understand certain definitions. And then I got another cartoon in here. Can you guys see it? It says, please turn down. This is something that I was doing actually for my daughter who's at Georgetown. So it's kind of, it doesn't end, but daddy is trying to do your homework. These are growth curves, and you can see on the ordinate, which is the top, which is the age, and then the abscissa, the weight and length. We track kids' height and weight parabolically, and you can see, you know, when the kids come in, we can actually pick up a lot of information on issues that, you know, occur just from each of the well checks. And you can see then on the numbers on the top for both the girls and the boys, how frequently we see the kids based on the months. And those are the well checks. I'm sure many of you remember your like well checks and you came in to see the doctor for those dreaded vaccine shots. Are children little adults? So they're not, you know, and that's one of the things that I'm really pressing for, both at the local, state, and national level. Pediatrics is not, you know, a primary care. Pediatrics is a subspecialty. You know, children are developmentally unique. They're going, obviously the kids born today are going to live a longer life than me or any of the other adults on this, and as well as for you guys as well. They're different altogether. There's unique exposure issues. They have physiology that's different. And then this is something that's really near and dear to my heart. They're voiceless and they're politically powerless, which is a really important thing to understand. Children should feel empowered. They have a voice, and a lot of times what they go through and what they experience, traumatic or not, can be categorized as an ACE. And an ACE is an acronym for an adverse childhood event, which is something that our current Surgeon General for the state of California, who's a pediatrician like me, graduated from UC Davis, is really pushing towards incorporating that into all our physicals, and everything that we do as far as taking care of children is concerned is to address adverse childhood events. And then at the same time, kids can also be, you know, treated certainly the same way. There's, you know, the dietary allowance and medications, but then we also have to be really cognizant of like the exposures and exposures and issues as far as children are concerned. And then I included like ages and stages that pediatricians are responsible for. And then in each one of these, I included, you know, different stages of life that pediatricians are, you know, able to take care of. Keep in mind, right here at the 20 to 36 week mark, a pediatrician can actually, at about 23 to 24 weeks of age, and a child no bigger than perhaps my 3 fingers, we can actually you know, save and help them grow if they're born too early. These are developmental milestones. Again, at the same time, you know, the height and weight graph that I showed you guys, it has like now ages and stages, which is another aspect of physical examinations that we actually incorporate into our examination and history taking when we see kids at the clinic. And I'm not going to go through this, but it's a complex way of being able to address any developmental issue that a child may sometimes present. And then we take care of the newborns and infants, toddlers. We go into early childhood and preschool ages, late childhood, adolescence, and then the young adults. And you know, there's always opportunities as far as pediatricians are concerned. You don't have to do what I do and be in a clinic and take care of patients. You can, you know, work at the California Department of Public Health and be an advocate for population health. I have a master's of public health that I obtained halfway through my career at Johns Hopkins because I was really interested in population health. And there are opportunities when you become a physician to do other things if that's what you're interested in. You don't necessarily have to do clinical medicine. So that's it.
Great, thank you. Looks like we do have a couple of questions in the chat, and since you're still on, I'll address the first one to you. Have you faced any hardships in your journey of becoming a pediatrician?
Yeah, lots of it. I think back when I was going to medical school, and I think Dr. Walker would probably agree with me, is that we would not be allowed to, you know, go home and take a nap or be provided, you know, a little bit of leniency. Call for us both as medical students and as physicians sometimes stretched 48, 72 hours. I remember back when I was training as a medical student, it just started the issue about, you know, doctors being on call and not getting any sleep, but it was still in its infancy. And I remember being awake one time, during one of my OBGYN rotations for about 48 hours without any sleep. I would say that was probably the hardest thing to actually endure. That's not going to happen now with the way things are running through the LCME and the ACGME. You guys will get naps and you'll be able to, go away and sleep, and there's only a certain amount of contact hours. But that was really tough. That was kind of old school tough.
Same question to you, Dr. Walker and Dr. Bilyeu, if you would like to answer, if you faced any hardships in terms of becoming your specialty, what did you do to get through them?
So I actually, my biggest hardship came during my senior year of college when I was diagnosed with multiple sclerosis, and I had to make the call to continue education or not. And my reasoning behind that was, at the time when I was diagnosed at 21, there were only 3 drugs that treated multiple sclerosis. And, there were all these stories about, basically people becoming, getting into wheelchairs or not being able to walk, or even potentially just not having, as long of a life as I had always anticipated having. And I was at that time with my boyfriend, or my fiance at the time, who is now my husband of 18 years. At that time, I just looked at him and said, I don't know that I should go to medical school, because what if I, can't walk in 5 years? I mean, is it worth doing all this for that? And he asked me, is this what you want to do? He said, you can't let the possibility of something bad happening stop you from doing what you love. And as I think, and a very important thing, because you don't know what the future holds for anybody, regardless. I could have been hit by a bus the next day. You don't know. And so, fortunately, as my disease has been very mild, I have had multiple flare-ups through my training, and I've had the support of my staff, the residency programs, and various attendings that got me through them. Now the drugs are so much better and so much more effective that I haven't had any relapses in at least 5 years. So it's always something. The hardships will come, and you just work your way through them. And if you have supportive people around you, you can really do anything that you really truly set your mind to.
Dr. Bilyeu, same to you. Same question.
Yeah, I would say, I think for me, the hardships were just, I think it might address some of the other things were, I think in college, like having setbacks in terms of, grades and classes, and having to do what I then saw as setbacks, and having to do a post-baccalaureate year were really difficult. And, having the support of my family was really essential. I think throughout medical school and residency, honestly, you as a woman and as a woman of color, I had to overcome some instances of racism, and that was really hard. And just, always feeling like I had to do more than some of my co-residents or my other medical students. But again, I love what I do, and I continue to fight against those inequities and try to make it better for that next generation. But I wouldn't change it at all.
So there's another question for you. Did you ever find it frustrating when you had to study the other branches of the medical field, chemistry, physics, especially
Yes.
since you would be focusing mainly on the brain and psychiatry? This person doesn't see how psychiatry really relates to those subjects. Can you address that?
Yeah, so funny enough, organic chemistry and physics were 2 of the classes that I bombed in college. So, and I really struggled with that. And, when I was in college, and even my first couple of years of med school, I thought I was going to be a surgeon. And so, you know, it's really hard to understand, like before you get into medical school, how all of these things actually really do come together. And, you know, I always joke that say, if I had to do it over again, would I take, you know, I don't know what I would do about organic chemistry because it was just awful. But, you know, it was frustrating, but you just kind of keep your eyes on the goal. What is the end goal? Because it was a necessary evil for me to get through it, to get to what I wanted. And I would sit through organic chemistry again. I actually came to really, when I took physics the second time with a different instructor, I actually really came to enjoy it, and really found it very interesting, and kind of looked at, I love history. And so I started to learn more about the history of physics. And so that really helped me to kind of tie it to something that I was interested in. So, yeah.
Thank you. Dr. Khaira, going back to you, when you're given patients, do you monitor them until they are 21, or are they passed around to other pediatricians, say in your group, after a period of time?
So I try to mimic how my pediatrician down in Pasadena was. It was a small group practice, and there was a couple of us. And generally, many of the children that I see at the hospital, and they're brand newborns back, gosh, 96, 90, are having kids that are bringing their kids to me now. So many of them will stick with the one particular physician. If it's necessary within the group, say for instance, and a child comes in, it's during a sick visit, and I'm not available, they'll see the other doctors that are in the group. But generally the kids will stay with me from stem to stern, and then we'll just have them go to see doctors like Dr. Walker or a family practitioner after they leave.
Okay, this is a good question. To become a nurse or a doctor, did you become a medical assistant, or do you recommend that as a stepping stone to get started?
So if you guys don't mind, I'd like to answer this. We have a lot of kids that in my office that want to, either do nursing, or they want to do medicine, or they don't really know what they want to do. I've got kids that have been my patients, that become my students, that become medical assistants, that became a nurse, that then went to Stanford, then went to medical school, and now he's an emergency room doctor at UC Davis. I have other kids that, come in from like some of the local medical assisting programs, and then they'll do their rotations at our office, and then they'll, come and work for us. It all depends on what you like and what you want to do. It's not necessary to actually run through every single thing in order to decide what you want to do, but it's sure nice to be able to kind of do one thing or the other and decide, this is what I like, this is what I don't like. So it's always open to going ahead and making a decision, either on the fly or from the beginning. It doesn't really matter.
I also recommend looking at being a medical scribe. That is a really cool way to get almost hands-on experience. You get to follow and a variety of physicians, emergency room docs use them. Lots of different outpatient physicians use them. And so you get to be in the room with the physician, looking at everything. You get used to ordering, and it's like a little mini internship of going on. You learn all about the language and kind of the life of being a physician. So if you ever have the opportunity to train to be a medical scribe, that is also a really good stepping stool.
Great, thank you. So it looks like some of these we've kind of answered. But Dr. Bilyeu, how long did it take you to actually become a practicing psychiatrist? How many years did it take?
So after college, so 4 years of medical school, 4 years of a general psychiatry residency, and then I did an extra year of training, which is called a fellowship. I think Dr. Walker said hers was 3 years. Fellowship training varies from like 1 year, I think, all the way up to some are like 5 years long. So Yeah, but so total for me, including medical school, was 9 years. Yeah. So I graduated from medical school. I started medical school in 2004 and started my first big girl job in 2013. So
All right, we have time for one last question. Yes, 9 years is a lot. Dr. Walker, if you're someone with a chronic illness or disability, does it make it significantly harder to become a physician? Are there any support systems in place in the medical system for physicians with disabilities? Great question.
Yeah, so it will unfortunately make it more difficult, and that's because this world is not set up to make things easier for people with any type of disability, and that's something that we need to continuously, push for. Like I said, fortunately, I had very little physical disabilities that stopped me from doing my job. I just needed time support to go to infusion centers to get my medications, and I was taking a few days off here and there, but I didn't deal with a constant debility that or disability that made it really, really challenging. I went to medical school with a physician who had very severe cerebral palsy, but she actually made it through, and she chose a specialty that was a little bit less physically demanding. I would not recommend, if you had a really, severe physical disability, to go into something like what I do, because it's incredibly physically demanding. I mean, I work crazy long hours and have to run to codes and do procedures and on my feet. So doing specialties that are a little bit more cerebral, that allow you that flexibility, would be a good option. So there's a place for you no matter what in medicine. You just need to find the pathway that will fit you. As to specific resources, I'm not sure. I'm sure that to the various societies around for any specific illness that you have, they would have things. And then in the medical schools themselves, they have ways to support you, and staff there that will help you with your rotations to make sure that you're covered. So fortunately, I think things are getting better, and they're recognizing we need to support people with different physical disabilities to do stuff. One of my partners has lost his eyesight, and it's so bad, he can still intubate by listening to breath sounds. So when he puts that tube in, he listens and actually can hear the breath sounds coming through the tube and puts it in. It's crazy what you can do when you need to, but you will have to work harder.
Hey, Lindsay.
Great.
Lindsay, can I say one thing? Kids, if all of you or any of you are interested in medicine and want to talk about it a little bit more, or see how it actually works fundamentally at the clinical level, Lindsay can give you my contact information, and we'd be happy to go ahead and have any of you shadow us or see any of the providers. One little tidbit of information is that if medicine or the medical field is something that you guys want to do not ever stop. Laser focused, like my father said when we came to this country, you don't shine like a light, you go through life like a laser, and it's one thing that you do. It's a service profession. It's something for your fellow man to help other people. I can't imagine doing anything else. Even if I didn't like organic chemistry, like Dr. Bilyeu said, or any of the subspecialty oriented sciences, you still have the eye on the ball and enjoying what you're doing. It's a self-fulfilling prophecy. If you like what you do, everything else is worth the game, okay? So just stick to it.
Exactly. Well, please, everyone, join me in thanking Drs. Walker, Bilyeu, and Dr. Khaira for joining us this afternoon. We really appreciate you taking the time to talk to all